Spaying your bitch has several benefits. It will prevent unwanted pregnancies, phantom pregnancies, and reproductive tract related diseases like pyometras, uterine tumors, and mammary tumors, and it will prolong the lifespan of your dog. Here at Penbode Vet strongly recommend spaying your bitch. We use two techniques, traditional techniques and laparoscopic spay. Laparoscopic spay, also known as keyhole surgery, is a procedure in which we use an endoscope. The main advantage, compared with the traditional approach, is that we make smaller incisions, leading to a much less painful recovery. We can spay your bitch at any time in her life, as long as it is 2 to 3 months after the season. We can even do it before the first one, although we recommend to do it afterwards, so we can assure they've grown both mentally and physically. The exception to this rule is those animals from large breeds, in which case we recommend to wait a bit longer, because they can be growing up to 2 years of age. Your animal will come for a physical examination a few days or weeks before the operation. It will help us to assure she's fit for the surgery and she's suitable. It will also give us a chance to discuss any concerns or doubts that you might have. To help minimizing the anesthetic risks and to facilitate maintaining the blood pressure throughout the surgery, your dog will have food therapy. We can also offer a pre-op blood test. This will check the kidneys and the liver and make sure they're in perfect working order beforehand. Once your pet has been admitted, she will be checked again by the nurses, and the blood sample will be taken if you have opted for it. If everything is within normal values, then she will be premedicated. The premedication will help her to be more relaxed, provide with pain relief, and facilitate the anesthetic. We will also place a catheter that will give us access to the bloodstream. This is how we administer the anesthetic drugs and the fluid therapy. And if things come to worse, we can give emergency medication. Once the bitch is under anesthetic, we will prepare it for surgery. We will clip and clean all the abdomen. The reason for this is to be ready in case we have to do a large incision in the event of any complications. Once the bitch is in theatre and the surgical area is thoroughly clean, we make 3 incisions. In these incisions, we place 3 ports through which we can pass all the equipment for the procedure. The endoscope is connected to a camera, and this is connected to a screen. These allow us to see everything magnified, providing with a more precise procedure. In the laparoscopic approach, we just remove the ovaries. To do so, we use a special tool that will cut the tissue and stop the bleeding at the same time, minimizing the risk of hemorrhage. Once we finish the operation and we're happy that nothing is bleeding, we'll proceed to close the incisions with simple stitches. Then the bitch is moved to kennels, where we will be closely monitored by the nurses and make sure she recovers smoothly. They normally go home the very same day, so once your bitch is fully recovered, we will call you to arrange an appointment for you to collect her. She will go home with a busted collar or shirt to prevent her from leaking the wind. If you don't have any, we can provide you with one. We will see your bitch for 2 post-op checks, 2 to 3 and 10 days post-operation. Once at home, we recommend 7 days of rest, walking on the lead only for toileting purposes. Following this, there will be 7 more days where she can be walked on the lead a bit longer. If everything is okay at this point, she should be able to go back to her normal activity. Remember that laparoscopic spays are much less painful than traditional spays, but not 100% pain-free. Your bitch will be discharged with pain relief. However, if we think it's necessary, or you think she's in pain, we can provide with more medication, or we might ask you to come back for a check sooner than we mentioned before. Finally, if you're interested in having your bitch spayed laparoscopically, or you have further questions, please do not hesitate to contact us.